Ginger, a spice in wide demand, also keeps a special place among medicinal herbs because it contains gingerol and many other bioactive compounds that carry many health benefits. This video looks at daily ginger intake and its benefits, as well as shares some concerns regarding the regular use of ginger, alongside scientific researches from the PubMed. For thousands of years, ginger has a storied past as a traditional remedy, especially in Asian, Indian, and Arabic herbal traditions. It has been recorded in ancient medical records to be used for stomach disorders, nausea, and pain relief, and many others, pegging modern scientific research on healing properties of ginger with age-old wisdom. In this video, we break down the research on daily ginger intake to find out how much of an effect it has on each system. Everything from cardiovascular conditions to the immune benefits of healthy ginger consumption, plus tips to help you avoid overdoing it. But first, a quick reminder. All content is for informational purposes only and should not be construed as medical advice. Always speak to a healthcare professional before introducing changes to your diet or lifestyle, as some health circumstances and drug interactions could be impacted. When to avoid eating ginger. Ginger is good for a lot of people, but certainly not everyone. Side effects and precautions. Patients with blood disorders should avoid it because it may prevent clotting. Pregnant women are urged to consult before taking a DO to kick up the traces of a probable chance of miscarrying. Moreover, people on warfarin or with gallstones should not take ginger in order to prevent drug interactions and the worsening of symptoms. Those with heart conditions should also be cautious when consuming ginger. Stimulates peripheral circulation and has been recommended for cardiovascular health, but will reduce effectiveness of certain heart medications such as beta blockers and calcium channel blockers. It is vital to consult with a healthcare professional so that ginger root does not impact the rhythm of your heart or your blood pressure. People who are in the process of undergoing major surgery should avoid consuming ginger for up to 2 weeks before their operation. Ginger is also a blood thinner that can cause an increased risk of dangerous bleeding when taken as a supplement immediately before or after surgery. This safety measure helps to control the risk of bleeding and, consequently, enhance convenience in completing a surgical procedure. What happens when you start consuming ginger every day? Integrating ginger into your daily routine can lead to noticeable health improvements. Here's what current research indicates about its daily consumption. Better blood flow. Blood flow is energized by ginger, which can help nutrients and oxygen be transported to the body more efficiently, as well as general vitality. This increases blood flow to assist in clearing metabolic waste from cells, making detox easier. This detoxification not only improves the functions of organs, but also helps in enhancing skin health and skin appearance. Optimal circulation of blood and nutrients is very critical for the smooth functioning of every organ and tissue, which ginger enables. What is more, improved circulation can help the body maintain a better working temperature throughout. People with common cold feet and hands can have regular ginger in their food that will normalize the temperature of the body. Ginger also warms the body, a bonus for people living in cold weather or those with circulatory challenges. Acid reflux. Ginger has been used for centuries to treat a number of conditions, including dyspepsia and acid reflux, by stimulating the production of digestive enzymes, which could help break proteins and fats down more effectively, so they are less likely to build up in your stomach undigested, triggering acid reflux symptoms. Moreover, the anti-inflammatory effect of ginger helps with reducing stomach inflammation, which is a common problem that worsens our acid reflux. Ginger pacifies the tummy muscles and simultaneously keeps at the lip of toxic-making acid, rendering a nicer digestive experience. Preventing this may reduce some of the discomfort or burning that patients frequently experience from GERD. No headache. Ginger has anti-inflammatory effects, can help to relieve any inflammation in the blood vessels that is causing a headache. This is because ginger prevents the production of prostaglandins, substances which participate in pain and inflammation. Furthermore, The essential oils and aromatics present in the root are calming to the nervous system, which helps bring peace to headaches, decreasing the epidemic of excited nerves that all too easily leads to stress and tension headaches. Ginger is a relaxant. It eases the mind into a state of soft, responsive focus. Less inflammation. Gingerol interacts with immune system pathways that regulate inflammation, apparently decreasing the synthesis of cytokines and chemokines as inflammatory mediators. Ginger is also rich in antioxidants, which play a major role in its anti-inflammatory mechanism. Ginger scavenges those pesky reactive oxygen species that lead to cellular injury and inflammation, thereby helping our cells stay safe. Soothe tooth pain. It is also antibacterial and anti-inflammatory, which means it can help reduce tooth pain and kill bad oral pathogens. How does it work? On the other hand, its natural saliva excellence assures an effective oral hygiene. This increased salivation flow helps to remove food particles and debris from the mouth, which lowers the risk of plaque deposits and oral infections. In this sense, ginger can help not only to relieve pain but also to keep your mouth healthy in the long run and prevent oral problems from appearing. No morning sickness. In a similar manner to slippery elm, ginger also acts on the gastrointestinal and central nervous systems, improving acidity levels in stomach by increasing gastric motility. This can prevent the contents of the stomach from moving upwards, which often precedes nausea. Most importantly for pregnancy, it has a mild effect on digestion, helping food move through the stomach quicker and preventing those things that trigger morning sickness. Additionally, the use of ginger as an anti-anxiolytic, by calming the nerves, can help lessen overall psychological stress. Ginger soothes the nerves in general, and this calming effect can be really helpful for dealing with a number of things that expectant women face, like morning sickness, overall discomfort, less sore throat and cough. Its antimicrobial and anti-inflammatory properties help relieve the throat, hence coughs and soreness. Plus, ginger has a gentle warming essence that helps to soothe a sore throat. For consumption, culinary or as a tea, it can bring instant and sedative warmth to reduce that irritation in the throat. This natural heat not only soothes the throat, it also helps loosen mucus, which can help in dispelling phlegm and reduce coughs. Additionally, ginger contains volatile oils with expectorant action that helps remove phlegm from your throat and lungs. No farting and excellent digestion. It helps guard against gastrointestinal issues, bloating, and allows for breakdown and absorption of nutrition. Ginger contains vital enzymes, but the one enzyme that aids in protein digestion the most is zingibane, being an active promoter of gobbling up proteins and need to correctly digest for improved energy and ultimately lessening gas bloating. With the help of the enzymatic activity, you get a better overall digestion not only with proteins but also fats and carbohydrates. In turn, you experience clearer digestion with less gas and bloating issues. Ginger also aids digestion, with its influence on the gastrointestinal tract involving increased gastric and bile secretion to enhance digestion and help eliminate unwanted fats. As a result of this increase in secretory activity, the digestive functions which protect proper levels move through the gut quickly. The regulation of these gut processes by ginger can help to keep your gut healthy and so prevent indigestion and flatulence. Frequently asked questions. Given that it is becoming increasingly popular, there are many doubts about ginger daily intake. Here are answers to some of the most common queries. Who should not take ginger? Ginger can also not be taken by anyone with blood disorders, on any kind of blood thinners, or pregnant. Moreover, people with hypertension should warn the use of ginger as well. When added to antihypertensive drugs, ginger may cause blood pressure to plummet dangerously low due to its natural effects for people with hypertension. This can produce symptoms of dizziness, lightheadedness, or even fainting, especially during moments where regulation of the blood pressure is essential. Ginger is also not recommended for those with gallbladder disease. Ginger also promotes bile production, can be too much for those with gallstones. The higher volume of bile production may cause significant discomfort, and in people with gallstones, even serious consequences resulting in medical treatment. Can I drink ginger every day? Ginger can be consumed in moderation daily to obtain its health advantages, so long as you do not have any underlying medical condition that would counterindicate it. Everything in moderation. What you need to remember when consuming ginger on a daily basis: most adults can safely consume up to 4 grams of ginger per day. Above this dose, and you may suffer from minor side effects like heartburn, diarrhea, or just a nauseous sensation in your stomach. Always start with the lowest effective dose and work your way up to find what amount of cannabinoids are right for you. People who want to incorporate ginger into their diet can use it in cooking or drink it as a tea. One of the most common ways to take advantage of ginger and its health benefits is in the form of ginger tea. It can make digestion of your favorite post-meal foods easier. It warms you up on a rainy day and provides comfort during anxious, stressful moments. You can also spice up your meals and snacks by adding an intense flavor to your recipes. It's also easy to include fresh ginger in your diet. Are there any side effects of ginger? At high dose, you might get more common side effects. Things like heartburn, diarrhea, general stomach troubles. At high dose levels, the only side effect of ginger is that it changes blood sugar readings. While rare, a small percentage of people experience an allergic reaction to ginger, lead to a reaction with symptoms similar to of an allergy ranging from itching and swelling, even respiratory issues. While animal and human studies suggest that ginger could help treat nausea, especially during pregnancy, the only way to know if you are allergic to ginger is for you to have an allergic reaction after consuming it, in which case you will need to seek medical attention immediately. Always introduce new supplements or significant dietary changes specifically under the supervision of a professional, especially if you have known allergies. Is too much ginger bad for the liver? These mechanisms may result in an overload of the liver's capacity to metabolize these substances quickly, and there is a possibility that the benefit of essential drugs will be reduced, or toxicity could increase. It is wise for people who are on multiple medications, however, to discuss with their healthcare provider what amount of ginger may be safe to use. And it's important to remember that while some compounds found in ginger can be potent at high doses, adversely affecting liver function, but quite likely other bodily functions as well, not everything else in your body gets a free pass. For those adding ginger to your diet, especially as part of a supplement, probably keep an eye on it so that you do not yet end up in stinking foray with the liver health and well-being. Is ginger water good for weight loss during the day? To lose belly fat, ginger is not enough with just its metabolism-enhancing characteristics. It must also be used in conjunction with a good diet and exercise. One of the factors that contribute to how ginger helps with weight loss is its role in improving thermogenesis, heat production in the body. Ginger can increase the metabolic rate and help in burning more calories throughout the day, a critical factor for reducing body fat around the abdomen as well. Ginger water is, as such, an ally for those wishing to boost their weight loss process, but especially if mixed with cardiovascular and strength training. You're more likely to engage in unhealthy snacking and consume excess calories when you have cravings and are vulnerable to spikes of sudden hunger. Regular consumption of ginger water can be useful in the regulation of these levels, which may help control food intake and ultimately decrease belly fat. If you liked this video, give it a thumbs up and make sure to subscribe and click the notification bell to stay updated with our latest health tips. Do you have any experiences or questions about ginger? Let us know in the comments. We want to hear from you.